This is Annika Nath. She's 5 years old. Annika is doing something her mother Monica wasn't sure she would ever be able to do. She's walking. Annika has cerebral palsy, or CP, as a result of a brain injury at birth.
Earlier I used to be very, very sad. The first couple of years of her life. She is what she is and I just have to get her better. That's how I feel now.
For the first 3 years of Annika's life, her parents searched for therapies that would help Annika develop.
We tried a lot of therapies with her initially, and I would do a lot at home with her, but nothing was satisfactory.
By age 3, Annika's development was severely arrested.
She could sit, but she would fall when she would try to pick something up because she had very poor balance.
Then she discovered the TheraSuit method of intensive physical therapy.
When I came here, now she is in a walker in school all the time. And I think that's huge for me.
Annika, now 5, has been coming to the TheraSuit Center twice a year for the last 2 years. Monica is seeing the results, and so are others.
When the school therapists themselves are really happy to see that progress, they never imagined it. When I see the therapist saying that, I feel so good that she's going beyond what they expected.
The TheraSuit method is the new standard of intensive physical therapy for children and adults with cerebral palsy, spinal cord injury, or neuromotor disorders.
Take it. 1.
Our goal was bring new kind of therapy, new kind of like a consciousness.
Richard and Isabella Koscielny are the founders of the TheraSuit method. Their model clinic, the TheraSuit Center, is located in Keego Harbor, Michigan. It offers a new type of treatment based on the very latest research on exercise physiology.
The standard therapy is based on the philosophy from the 60s and 70s when the medical and research from the exercise physiology was not developed. This kind of therapy is much more advanced, is supported by the research, is supported by the physicians.
Richard Topolewski's son Zachary has cerebral palsy.
You start contrasting them to other kids or what other kids are capable of, it gets really tough.
Seeing his son's lack of development was difficult.
The school system allotted us, I think, like 20 minutes 2 or 3 times a week. And again, that was, in terms of one-on-one individual time. But the school system therapy really wasn't moving them along as we would like.
Navigate.
Richard and his wife Debbie decided to try TheraSuit therapy. This video was recorded prior to Zachary beginning the TheraSuit therapy. He has difficulty sitting and is unable to hold himself up on all fours, let alone stand or walk.
Zach is very delayed. He suffers from a lot of spasticity, which totally inhibits his function.
When we first came in therapy, he wasn't able to roll. We got the rolling, get him to standing, being stable, then taking the step, and then building upon step after step.
Less than 2 years later, Zach is able to take steps with the help of a walker.
This is another phenomenal thing, that with persistence, that with this incredible dedication, even the most involved kids do succeed.
Patients using the TheraSuit method train 3 hours a day, 5 days a week, for up to 4 weeks. The TheraSuit is so effective that it's now being used in some of the finest healthcare facilities in the world, including Easter Seals, United Cerebral Palsy clinics, and numerous children's hospitals. Since 2002, Richard and Isabella have trained over 2,000 therapists in 120 clinics worldwide. Kevin O'Neill is manager of the Outpatient Therapy Center at Crittenton Hospital in Auburn Hills, Michigan. He has specialized in the treatment of CP and spinal cord injury for over 12 years.
Even within the hospital system, there's a higher recognition for this intensive training.
Kevin and many on his staff have been trained by the Koscielnys and have incorporated much of the philosophy and techniques of the intensive therapy model into their clinic.
This is going to do more and have a longer outstanding benefit as opposed to the traditional method. We're getting kids in here and we're getting them better faster.
For Richard and Isabella, who both hold master's degrees in physical therapy, it is less of a business and more of a passion. Their 16-year-old daughter, Kaya, was born with cerebral palsy.
She's this incredible inspiration to so many other kids, and she brings so much joy from the other angle, when I sometimes look at her, how much more work she has to do to keep up with just the daily life skills, it sometimes really gets to me.
Like other parents, the Koscielny's tried numerous treatment programs. None gave Kaya the results for which they had hoped, except one, a therapy center located in Poland. Here they learned of the intensive style of physical therapy as well as a rehabilitation suit. With its help, Kaya began walking. Richard and Isabella returned to the States and were the first to introduce this type of program in 1994. In 2001, the Koscielny's designed and patented their version of the rehabilitation suit called the TheraSuit. It is FDA registered and is utilized in the U.S. and around the world. After establishing their program in a local hospital, Richard and Isabella started their own state-of-the-art intensive TheraSuit center in 2003. TheraSuit is also being used here to help those with developmental delays, traumatic brain injury, and post-stroke victims, and those with ataxia, athetosis, and hypotonia.
Did it, strong girl. Yeah.
Julie Roche's granddaughter has CP. Julie is helping to take care of her.
At about 5-6 months, when she wasn't developing normally, then we realized that she was going to have some lifelong problems.
As Sarah matured, things got worse.
She could not sit up, she could not crawl, she could not walk, she couldn't feed herself.
Sarah started occupational, speech, and physical therapy through a Head Start program, but the results were disappointing.
I wouldn't say useless, but you're not going to get as much improvement with just 1 hour per week of any of those things.
After just 2.5 weeks of intensive therapy, Sarah began to improve.
Sarah can sit up by herself for about a minute unassisted. She can roll from back to front, which she was not able to do. She's realizing now that she can do more things. I have visited a lot of other therapy places prior to coming here, and this was, as soon as we walked in the door, very welcoming, very child-friendly, very child-oriented.
If they're coming from 50 miles away or from out of state or out of the country, that it is a hard trip for them to travel, and we try to make it as comfortable as possible. We have also nice little rooms that they can go into, be quiet and get away from. Just makes their trip a lot more pleasant.
There's basically no comparison.